Hi, team. Welcome to Head to Total. I'm Colleen Young. I'm your host. We have an exciting guest today. We always have exciting guests, but I was really excited to hear that Dr. Rasheed Abiola from Mendelssohn Kornblum Orthopedics is going to be with us today. I have got to tell you, I met Rasheed a few months ago. Fascinating guy. First of all, wickedly talented, but what a story. And I can't wait to talk to him today. Without any further ado, Dr. Rasheed Abiola, welcome to Head to Total. How are you?
I'm fine, thanks. Thanks for having me.
It's great to have you, Rasheed. I'm so excited. Congratulations. You've been with Mendelssohn Kornblum for a few months now. How is everything going?
It's been going great. Getting a chance to meet the staff. It's always nice. And then obviously the patient volume going up. It's pretty good. So I'm very excited with the way the practice is shaping up.
Absolutely. I'm happy for you. We're excited that you're a part of that team. I can't wait to talk to you. I want our audience to know who you are. Give us the story of your fascinating background and how you came to Mendelssohn Kornblum. Just give us the whole story, Rasheed.
Well, in short, I am the son of Chief MKO Abiola. He was actually the first democratically elected president of Nigeria. And I was fortunate enough that I was born in London, England, and then moved to Nigeria. And due to circumstances involved in this presidency, my mom and my four older sisters moved here to the United States in Maryland. Unfortunately, my dad passed away 2 years after moving here. So we made a family decision to stay in the United States. And following this, I decided to finish my high school and then end up going to University of Maryland in College Park. Did a neurobiology physiology major. Then went on to Chicago Medical School, completed my medical degree. And then from there, matched into orthopedics at University of Wisconsin. And then a fellowship at University of Utah.
You getting into orthopedics. Was it something that you wanted to do lifelong, or did your father's passing inspire you to go into medicine? Can you talk to us a little bit about that?
My dad passing away from a heart-related condition made me interested in medicine. Initially, I thought I was going into cardiology. And when I took my my step one, I started to look at other specialties. And it wasn't until, I think about that summer, the American Academy of Orthopedic Surgery had a conference in Chicago. And a buddy of mine was staying with me, as med students are to save money. And he said, why don't you come to this conference and listen to a bunch of orthopedic surgeons talk about why they like the specialty? And then from there, I kind of got interested, and I just realized that, these surgeons reminded me of myself. I was very into sports. I was very athletic. I enjoyed the lifestyle of making patients feel better. And then I kind of decided to turn my attention more towards orthopedics. At the time, I had a research, but it was more related to cardiology. I have a publication in orthostatic hypertension, but I really wanted something that would introduce me to the field of orthopedics. So at the time, there was a new clerkship that just started. It was a Ruth Jackson Steindl clerkship at University of Iowa. So I applied for it, not thinking I was going to get it. So Ruth Jackson was the first female orthopedic surgeon in the United States, and she trained at the University of Iowa. And Iowa wanted to kind of celebrate inclusion by inviting female medical students, and they actually invited myself as well to be the first class of the Ruth Jackson Steindler clerkship. So when I got there, they had actually lost my application. So I had applied to do joints. So they had lost my application, and the only rotation that was available was spine. So no medical student wanted to do spine surgery rotation, which I found kind of interesting. But I liked neuroscience, and I didn't really think about it. But I said, sure, I'll do it. It was a clerkship. It was supposed to be research based, but they wanted me to do more clinical. So my first ever orthopedic procedure that I saw was 16-hour scoliosis surgery. and I actually had 16 hours. I actually had dress shoes on. So I had a back pain, no pun intended, uh, literally for a good 2 months because I was wearing dress shoes that was incredibly uncomfortable. And that was my first introduction to spine surgery. And then from there, I went to Johns Hopkins and I did the pediatric orthopedics surgery rotation under Paul Sponseller. And I just loved him. I loved everything about him. I loved the way he took care of patients. I loved the way he explained the spine more towards pediatrics. And then I had a little brief moment with him, and I said, "Hey, Dr. Sponseller, where did you do your residency?" And he said, "I did my residency at Wisconsin." And he said, "You should strongly look at it. It is an amazing place." So from there, I pulled up my application and I checked off Wisconsin, and I knew at that point that that's where I wanted to go. And fortunate enough for me, I matched at University of Wisconsin, which had an extremely strong spine division. I mean, I had no idea what I was walking into. I mean, you had pretty much pioneers of spine surgery in Paul Zedeblick, Clifford Tribune, Paul Anderson, who was on the Becker Spine list of spine surgeons. And then also we just added a younger spine surgeon called Seth Williams. So I was fortunate enough to have such a great group of spine surgeons that I can call my mentors. And so during my fourth year, it was a no-brainer. Everybody knew, they saw the enthusiasm that I had about spine. So the first resident to do a spine fellowship from Wisconsin was Daryl Brocky, and who's the current chairman at University of Utah. So for me, at that point I said, I want to interview at Utah. I would love to see what it's about. And when I interviewed at Utah, a lot of his mentors were also my mentors because a lot of his mentors are still operating till today. So the interview was just organic. It was just a beautiful time there. And at that point, I knew for sure that I wanted to go to University of Utah to do my spine fellowship. And fortunate enough for me, and thankful to Daryl Brocky, Brandon Lawrence, and the guys there, I matched and I did my fellowship in complex spine surgery at University of Utah.
First of all, you and I have had several conversations offline. And for those of you who are listening, if you are someone who wants to get into orthopedics, spine surgery, I can't say it strong enough. If you have the opportunity to meet Rasheed Abiola, you have to, because as you can hear, he is just so well versed in all the education. Plus, I got to tell you, Rasheed, everybody talks about it. You are probably the coolest spine surgeon we have met, because this is the only snowboarding spine surgeon you can find. Rasheed, can you just, and we're going to go into more professional stuff, but would you please tell the audience, what's a weekend look like for Dr. Rasheed Abiola?
Weekends during the winter, I am obviously focusing on, during the weekday, obviously focusing on my profession, making sure everything's going well. But obviously, I'm keeping an eye on the weather patterns, typically on the west coast of the Mountain West. And if there's a snowstorm coming, I'm at that point I'm looking at how I can safely get there and get a couple of days of riding. So practically, my Fridays are typically half days. And if I'm not on call, as soon as I'm done with clinic and I'm done with my clinical duties, I typically am on a plane by 6-7 o'clock, and I'm pretty much in a city destination close to the mountains by the evening. And the good thing is the time difference helps actually, because you can leave here at 6 o'clock and you can get there practically almost at 6 o'clock, 7 o'clock as well. And most of these ski destinations, especially in Salt Lake City, is about 20 minutes away. So by Saturday morning, I'm gearing up and I'm hitting the slopes.
So this is what I love about you, because in all honesty, when somebody says to you, you have to go see a spine surgeon, it's terrifying to a patient who doesn't know the ins and outs. But when we walk into your office, you have this way about you. And if you in doing my homework to prepare for this interview, I did a little quick Google, and you have these reviews saying he's just so easy to talk to. He explains absolutely everything. I left there feeling better. I know I'm in good hands. Can you talk to us what it's like when a patient comes to see you, and what that experience is like, and how you walk them through the process of, I've got a spine or a back injury?
Great question, Colleen. Spine care involves all facets of the spine. And obviously, as a spine surgeon, I do the surgical aspect of it. But also, as a spine surgeon, I also initiate some of the non-operative modalities. A lot of times when patients come and see me, especially if they haven't had anyone evaluate their spine, the first thing I'm thinking about is how I can get their symptoms controlled with the easiest way possible without having to talk about surgery. So majority of the time when I see patients in my clinic, I'm actually not discussing surgery at all. My main focus is to try to investigate what's going on and control their symptoms. And I find it amazing that a lot of patients tell me that this is the first time they've seen their own x-rays, or they've had MRIs in the past, and this is the first time that they've seen their own MRIs. And I think that's pictures speak 1,000 words. It's important to sit down, educate patients, and I feel that a well-educated patient, in addition to the spine surgeon, becomes a team. And at that point, decision-making process becomes easy. But it's important to stress that majority of the patients I see are actually non-surgical, and even the surgical things can be treated non-operatively.
When you're treating somebody and they unfortunately do have to have a surgery, and I understand that there's many types of surgery, but I think most people, when they think spine surgery, large incisions, hours on the table, recovery time. There's a lot of intimidating things. What's, and again, I understand that there's many different types of surgery, but the surgeries that you're performing on average, what's it like? What's the incision like? What kind of tools do you use? Can you walk us through?
Yes. So majority of the procedures I do are one-level procedures, whether they are in the cervical spine or whether they're in the lumbar spine. They're typically about one-level procedures. And that in turn means that it is not as complex. Majority of them are routine procedures that are typically performed throughout the country hundreds of times. So typically, when I approach a problem, I try to see what is the most minimal way possible that I can approach the problem, and obviously treating the problem, still performing the goals of the surgery, which is to alleviate the patient's symptoms. And a lot of times, those things can be accomplished with the tools that we have at our disposal. In addition to that, spine surgery is always evolving. The old ways that spine surgery used to be done were typically midline incisions, pretty long. But now a lot of spine surgery can be done through minimally invasive approach, through lateral incisions that are relatively small. In addition to that, we're actually not doing the muscle stripping. We're actually just splitting the muscle, which leaves the insertion of the muscle and allows for an easier recovery.
When you're saying easy recovery, what is the average recovery time of a surgery that you just described?
Yes, most patients typically go home either the same day or they go home the next day. There's some surgeries that are staged, and those surgeries typically patients are in the hospital 1 or 2 days afterwards. But majority of spine conditions, most patients go home between a day or two of their surgery if it's not an outpatient procedure.
I know the Mendelsohn Kornblum practice that you're practicing out of, they have access to ambulatory surgery centers. Is that something that a spine surgery candidate could choose, or are they primarily done in the hospital because it's a 1 to 2 night stay?
Yes, a lot of spine surgery is actually done as an outpatient. Procedures like anterior cervical discectomies and fusions, typically 1 levels or 1 to 2 levels, can be done as an outpatient safely. In addition to this, you can do a 1-level decompression, which is where you take the pressure of the nerves at 1 level of the spine, or you can do a microdisc. These are procedures that are typically done on an outpatient basis.
In your current practice, what are you seeing? What conditions are you seeing the most of in Southeast Michigan? Is there a trend? Is it a stenosis? Is it I'm using words I don't even know what they mean. What are you seeing the most of right now, Rasheed?
Well, I have a community practice, so my practice is typically tailored to majority of them are degenerative conditions. So typically conditions that occur when the aging process starts to encroach of the nerve elements that are through the spine. And that could range anywhere from stenosis, which is narrowing of the spinal canal, or a situation where you have pinched nerve in the neck, or occasionally in younger patients, you would have a herniated disc, which typically happens in a lot of weightlifters and active people that do a lot of weights. So majority of what I see are typically degenerative and activity-related conditions.
Rasheed, is there anything as we progress in age, in the activities that we're doing, is there any like preventative tips or tricks that you could give us that to help make sure we're doing everything we can to have a healthy spine, to have a healthy back?
Great question as well. I always encourage my patients, the first thing is to avoid nicotine-related products. It's highly important to do that because what that does is that nicotine decreases the microvasculature to things in our spine that require in those blood flow. So our joints, our bone cells, and the nerves. And also nicotine can sometimes accelerate the arthritic changes of the spine as well. So the first thing that you can do is to avoid chewing tobacco, nicotine vapes, or smoking cigarettes. The next thing I would say is to try to have a balanced core. And a lot of times when you go to gyms, you see people working on the biceps or they're doing squats, but not a lot of people are actually working on their core. And a lot of the largest muscles in our body are actually the muscles that connect, that goes from the pelvis in our back all the way and attaches to the spine. So if we have a strong core, we're practically protecting our spine from any of the minute changes that could potentially lead to pain. Another thing that's for people who work in office settings, you can there are little balls that you can sit on. That could sometimes force you to create an upright posture, and it's a passive way that you can work on building a core. Things like yoga and Pilates are important things to kind of include in your activities. And I like to say that in the 5 years that I've been practicing spine surgery, I've yet to see a yoga Pilates enthusiast complaining of back pain.
Is there any value to hot yoga versus regular yoga?
I think that's all personal preference. At the end of the day, what you want is just to have a strong core and to make sure that you are that you are well balanced. And the important part is that if you have someone who has central obesity and they have a lot of weight ahead of them, or they're putting a lot of weight forward and their spine is imbalanced, which actually increases the intradiscal pressure and leads to sometimes herniated disc or increased disc degeneration. Similar to someone who doesn't work their abdominal muscles and they have very tight backs and they're not quite flexible, that could sometimes overload the part of the spine called the facets. So it's important that anytime you're looking at activities, you want to be well balanced. So if you do a lot of extension type exercises, the next day do flexion exercises like crunches. So if you do those things, I think that it'll lead to strong muscles around the spine and lead to hopefully less back pain.
It always amazes me, when you mention nicotine, how bad all of that is, on the body in so many different ways. I'm glad you didn't mention not drinking whiskey because, I think that's key to some of my good health.
It's important, everything in moderation. It's especially on the alcohol side. Obviously, the nicotine, you don't want any part of it, but on the alcohol side, anything in moderation will be the best.
Another fun fact about Rasheed, he enjoys cooking. which is just amazing. And then he plays the drums. How goes the drumming? Are you having a chance? Because I know you're busy in your practice. Are you having some chance to do some drumming?
I'm planning on buying a drum set, but I'm currently renting a condo, so I'm not quite sure my neighbors will be excited about that. But I'm hoping that once I purchase a small house or a townhome, I'll likely get one in the basement, and then I can get back to what I love doing. But I love playing the drums. I played for the choir when I was growing up. I also played in the band in high school. And because of that, my variety or my music taste is vast. I listen to a variety of music, all the way from heavy metal to electronic chill music to jazz. Just name it. As long as they play the drums and they have a good beats associated with it, I'm always thinking about how I could potentially play it when I actually play the drums.
Rasheed, I know that you spend a lot of time in the gym, and a lot of people nowadays, we're eating higher protein, less carbs. We're lifting more weights. We're trying to build muscle, especially those of us that are aging way too fast. And it helps with all that. But is there anything that we should be doing as we're lifting heavier weights, or is it more repetitions to save our back and make sure that we're staying healthy?
Yes, I would say start gradual. Definitely with heavy weights, try to use your legs. And it's always important to realize that extension is your friend. When it comes to the spine, they've done several studies that looks at what increases a lot of pressure on the disc. And the disc are like the shock absorbers between the bones of the spine that allows you to absorb any energy on uneven surfaces. And the study that I'm quoting noted that what puts the most stress on your spine is if you're leaning forward with weights in your hand. So you can imagine a lot of things that we do that involves that is if we're not using our legs and we go down to pick up a kid, we're putting a lot of pressure on the disc. If you're taking groceries out of the trunk of the car, when you lean forward and you're not using your legs, you're putting a lot of pressure on the disc. If you're doing kettlebell swings, you're putting a lot of, if you don't use proper posture, making sure you're stacked, making sure your spine is in extension, you're putting a lot of pressure on your disc as well. And anytime that you're not stacked over your spine, you put your spine in a little bit of a vulnerable and weak position. And that's typically where, unfortunately, some of my disc herniation patients come from. In addition to that, having a strong core also protects you for those moments that you're not quite paying attention to your posture. Having a strong core at baseline protects you from that little chance that you might injure your spine. So obviously, with lifting weights, build gradually. Make sure that you're paying close attention to your posture and your technique. If your technique is sound, then you can build stronger off those techniques. If your technique is not sound, then I would highly recommend that you go down in weight, build on your technique, make sure your core is strong, and then you're stacked over your spine in any activity you're doing, and then gradually build those weights up. And I think if you do that, there's a good chance that you'll have a healthy spine and injury-free.
How about those of us that sit in an office chair all day long? I have a tendency, Rasheed, to, how you kind of you cross your feet at your ankles and then you pull your legs back toward the chair. Does that affect your spine at all? And is there a proper sitting position that you should be in?
Anytime you brace yourself against something, you're actually not using the muscle. So if you lean back in your chair and you're in a relaxed position, you're not using the muscle. And then obviously, if you work quite a bit, there's nothing wrong with relaxing yourself and bracing yourself against a chair or against an object or what have you. But occasionally, it's important to sit up and prop yourself up. And what that does is that engages the muscles in the spine. In addition to that, it teaches you a proper posture. So once you're standing up, and if you're kind of stacked over your spine, you have a proper posture, which also helps in a passive way, which is kind of active, work on kind of building those muscles up a little bit. So I would say that, obviously, There's nothing wrong with sitting down in a relaxed position, but once in a while, sit up, prop yourself up for about 30 minutes, maybe every 3 to 4 hours, will probably help in making sure that your core is being engaged at some point of that work phase.
When I was, and I'm like twice your age, but when I was younger, they used to teach girls how to walk properly. They'd put books on our head just to keep us straight. Does that bring any value whatsoever, walking around with a book on your head?
Well, as long as the books is closer to your core, there's nothing wrong with that. But if the books are away from your core, then it puts a lot of stress on your disc. And that goes for activities like, if you do activities like Olympic lifting, when you pull that weight up, the closer you keep it to your spine or to your overall core, the better. So there's, you can argue that, what they were trying to do is they were trying to almost teach you to keep your spine stacked. By having a book close to your body, it forces you to kind of keep an upright posture, and then your spine is stacked, and then you're in a balanced position. So obviously, I'm not sure if there's any science to that, but I actually think that's actually a pretty good thing, and it's a lot preferred than if you're walking in class kind of slunched over, not being in a good posture.
Rasheed, I know that after this podcast that people are going to want to come to see you. So it's Mendelsohn Kornblum Orthopedics. They can go to the website, mendelsohnortho.com. You have your own page. There is a great video of you that people can get to know you even more. And then they can schedule an appointment. You're both at the Livonia, Michigan location and the Warren, Michigan location. Correct me if I'm wrong.
That is correct.
I can't thank you enough for the time today. I know you're a busy guy. I would love to see some snowboarding videos. I can't thank you enough for being here, and I hope to have you back one day on Head to Total.
Oh, thanks, Colleen. I'm very happy to be with Mendelsohn Kornblum Orthopedics. Very happy to be working with the staff that we have. We have a great team here, and everything from the person that checks you in to the medical assistants to actually be getting the privilege to take care of the patients that I see. This is a great team, and I'm looking forward to seeing every one of you all.
Thanks so much, Rasheed. Have a good evening.
Thank you.